Hi, everyone. Welcome. I'm Tafine from Congressman Peter Welch's office. I've been communicating with a lot of you. Welcome. So the Congressman will be on shortly, and we have a list of speakers, and then we have a open Q&A session, which I hope will be a great discussion. If you wanted to ask a question or make a comment during that session, if you can message me in the chat box or message everyone, I'll just call on you. That would be great. Okay? Thank you. Hi, everyone. I know a few people joined in the last couple of minutes. I'm Tafine Dean from Congressman Peter Welch's office. Thank you so much for joining. The Congressman will be on shortly. I thank you for all the speakers as well. I will introduce you after the Congressman's given his remarks. If folks have questions or comments during the Q&A session, if you can just message me in the chat box and I will definitely call on you. Thank you again. Hi, Congressman Welch.
Hello.
So we have folks just joining the call.
We can wait a few minutes, Tafine?
Yep, perfect. Hi, Congressman Pat. Let me know that I think we have everyone on the call now.
Okay, you want to get going?
Yes, please.
Well, I want to say thank you to everyone for being with us today, and I have such good memories of our visit in 2018. It's been a while, and so much has happened. The topic here is what we're going to do to help with substance abuse and help you. And we've got folks on this call who have been working long and hard, but I do want to thank several people for joining us. And before I do, I just want to say that none of us have ever seen anything like this. I mean, literally on January 19th, we had our first case, and now America has over 106,000 deaths, and we've got 1/3 of all the deaths of COVID virus around the world, even though we're only 4% of the population. So it's really, really a significant problem for us. So I'll get to it, but I want to thank our state reps who are on this call. They're going to have a huge job because a big goal of our relief efforts in Washington is to get money back to the state. And in the CARES package, there's $1.2 billion. And my view, there should be maximum flexibility for the state to utilize that in the way that is most helpful to Vermonters. So Representative Coffey and Representative Pajala are going to have incredible responsibility. And thank you. I think Sheriff Anderson is on the call, and I know you're doing incredible work down there. Really appreciate that. And I don't know if the state's attorney is on, Tracy Schreiber, but I really appreciated my visit with you as well and the work you're doing. And my frequent correspondent, Susan Avery. Thank you. But there's money that's coming back, $2 million in the CARES package to help with mental health and substance abuse in the CARES Act. And in the next bill that was passed by Congress, which is called the HEROES Act, which is $3 trillion, there is billions of dollars that are actually to go to the Samson grant. Is not allocated. It hasn't passed the Senate, but we're going to need resources for all kinds of reasons. But before I turn it over to you, I want to talk about a visit I had. Several of us had with the former Surgeon General of the United States under President Obama. And he was the Surgeon General in the aftermath of the 2008-2009 downturn. And what he spoke about was how there was a direct connection between the collapse in the economy, the economic insecurity, and an immense rise in anxiety, loneliness, opioid use, alcoholism, a sense of loneliness. And that's something I really, really fear. I mean, we now have 40 million Americans who are out of work. Just to give a vivid, concrete Vermont example, there was one company in Burlington where on Monday night, they had 240 employees. And on Tuesday, after the closure order came down, they had 4. And the anxiety that folks have who work in a business and like it, and part of their identity was being there, and then suddenly they don't have it, that in many ways is much more lasting than the anxiety everybody has about they might possibly get sick. Or I think for most of us, our real fear is that somebody we love will get sick. But there's, as you know, very well documented evidence about how when there's a big economic downturn and significant economic insecurity, and then the stresses of how do you educate your kids? Parents now are having to homeschool. Can you use public transportation anymore? Where's your next paycheck going to come? How long will your savings last if you have any? As you all know, that adds an immense amount of stress, and stress in and of itself has enormous health consequences, both physical and mental health issues. So I see this as an ongoing challenge. This is not going to go away. I mean, let's say we're really successful in getting the COVID spread down. Vermont's been, I think, doing well on that, better than almost every other state. But there is an economic dislocation, and in the aftermath of these challenges, mental health as well as physical, that you're on the front line of. So I say thank you for all the work that you've been doing, but unfortunately, you're a long way from going out of business, because a lot of Vermonters are going to need help. Tafina, I'll turn it over to you at this point.
Thank you, Congressman Welch. We'll hear from Rosie Nevins right now. Rosie is the program coordinator for the Windham County COSU. Hi, Rosie. Rosie, I think you're on mute. There we go.
Thank you. Thank you so much for having us and for putting this together. Tafina, I know you've been working very hard, and to the Congressman for having us here to talk about this in our community. I think I'll keep my role today sort of focused on the data. I think the Windham County Consortium on Substance Use is a group of about 14 different provider organizations, as well as folks with lived experience, substance use disorder and opiate use disorder in our community. And the COSU over the last 2 years have undertaken a project, which I believe you heard about last time. We've received the ARCORP Rural Communities Opioid Response Program, both planning and implementation grant to respond to the opioid epidemic in our community. And in 2018, COSU engaged in a planning process, which essentially was an evaluation of our community needs, looking at both the data as well as the service needs in our area and the gaps. And through that planning process, we learned a lot about the community. I believe Chad Simmons spoke with you last time. He was my predecessor. And so he was really, he was the director at the time that this community engaged in that planning process. And then I entered this role in November and really took all the data along with all of the COSU members and began to implement the plans that they had put in place. So just to sort of set the groundwork of what has happened or what we've seen since 2018 and what we learned from the needs assessment. And then I'll let the other folks kind of speak to what we are seeing now, because there has been quite a bit of a shift, as you can imagine, in the last few months.
Right. Thank you. Yeah. Thank you. Welcome. Thank you.
So in 2018, we had, well, really for the last 5 years, and since for the last decade, actually, the overdose death rate in Windham County has been on the rise, particularly in the last 5 years. From 2010 to 2015, we were seeing between 2 and 8 fatal overdoses a year. I think the highest year was 8 overdoses. Besides that, it was really between 2 and 4. But beginning in 2015 is really when we began to see a pretty distinct rise. In 2015, there were 2 fatal overdoses. In 2016, there were 6. 2017, there were 14. In 2018, there were 25. So overdose fatalities really peaked in 2018. And I'm glad to say that in 2019, it was the first time in 5 years that we actually saw a decrease in fatal overdoses, where we were down to 17 from 25. So because we're a small community, these overdose numbers are sort of result in very high rates. So in 2018, the rate was 58.5 per 100,000 residents. And in 2019, it was 39.8. And so while the Vermont statewide overdose fatality rate has hovered around 17 people per 100,000 for the last few years, here in Windham County, we're seeing about double that. And
Do
it's
you have a reason? Do you have an analysis about why that's the case?
I knew you were going to ask that. And I think, you know, if we knew for sure, if only we knew for sure, I think is the answer. I think there's a lot of folks have conjecture out of the needs assessment. A number of the challenges that were identified was, one is much of our county is rural, like a lot of Vermont. Transportation and access to services, particularly in the rural parts of the county, are difficult. Two is particularly Brattleboro and the part of the county that is connected to 91, the 91 corridor. We are geographically vulnerable to a very lucrative dealing economy. So a bag of heroin that would sell for $6 in New York may sell for 10 or 11 here. So it's a lucrative market in that regard. I think there's also some theories around overdose rates, in particular the overdose rates in Windham County, that because we are the first entry point into the state, Vermont is not a very large community in and of itself, and word about bad batches gets around pretty quickly. But where we're the entry point in the state, there's some theories, again, just sort of people's theories that, that this county, because being the entry point, if a bunch of overdoses occur here, the word gets spread throughout, communities sort of trickling up.
Right. Thank you.
Yeah. Sorry, I have many resources up that I'm drawing from. Some other things that we found in the needs assessment were, again, and I think the sharp increase in 2016, 2017, 2018 primarily correlates directly with the introduction of fentanyl. And so fentanyl is a synthetic opioid that is far more powerful than heroin, and but nearly identical. So it's very difficult to tell if a product contains fentanyl. There are fentanyl test strips, although at this point, the product in our local area almost all contains fentanyl. So many people don't find it useful to use fentanyl test strips because they essentially are all testing positive at this point. But you can see when you look at the data that the sharp increase in fatalities correlates directly to the introduction of fentanyl into the community. Thank you.
Yeah.
So
really appreciate it. Thank you.
So if other folks probably can speak to the shift that has happened in the recent months. Most of the data that I have came directly from law enforcement and first responders, because we're not able to get confirmed overdose cases. There's a several-month lag time with the state coroner's office to confirm overdoses. But roughly this year, from March to May, from last year, we've almost doubled. We've had almost the double amount of fatal overdoses just in these 2 or 3 months since we've seen the onset of the pandemic here. And so I'll let other folks speak to that. There are some thoughts. This is a national trend as well. There are some thoughts nationally as to why we're seeing more fatal overdoses.
Thank you, Rosie. We next have Chief Michael Fitzgerald. Chief Fitzgerald, thank you.
Oh, Chief, thank you. Glad you're here.
Can you hear me okay now?
Chief, thank you. I'm glad you're here. I'm glad you're on.
My pleasure. It's an honor. Thank you. I'm going to talk a little bit about Project CARE, and for some of the audience that aren't familiar with that, it's a community approach to recovery engagement that was conceived in the early mid to late 2018, and it is very loosely based on the PARI model, which is the Police Assisted Addiction Recovery Initiative. And our goal is to reduce the amount of deaths from opiates and other dangerous drugs and the impacts that they have on our community, basically by creating a non-arrest pathways to treatment and recovery. We have multiple partners who many of you'll hear from today, and I see their faces on the screen here. But some of the most strong stakeholders that we have are Turning Point Recovery Center, the Brattleboro Memorial Hospital, Groundworks, Abbott OpCo, Brattleboro Retreat, and Department of Corrections. 2019 was our first full year that we were in operation. And currently, Project CARE is unfunded and relies solely on volunteers. We conduct monthly meetings with all our stakeholders, and we do bi-weekly community outreach canvassings of the neighborhood. The outreach team usually consists of a combination of a Brattleboro police officer, recovery coaches, and groundwork employees. And the outreach is basically aimed at areas and individuals that are deemed most high risk. And that is based on data that we get from drug investigations and medical calls for assistance for overdoses. Ideally, we try to contact all victims of overdoses within 24 to 48 hours of the incident. And even the individuals that were present but didn't overdose, our outreach also includes them. In 2019, over the 100 contacts that we had, 37 people completed intake forms, and 25 have either engaged in treatment or still remain in treatment at this time. I'd like to give a brief snippet of some of the data that Rosie talked about, and just to show you where we are. In 2019, when we first started Project CARE, we had January, February timeframe, we had 20 overdoses with 3 fatalities. And that same timeframe, January and February of 2020, we had 10 overdoses with 0 fatalities. So we cut our overdoses in half by 50% and decreased our fatalities by 300%.
Fantastic.
It was really encouraging. Unfortunately, the only thing I can see the difference that happened between March through May of 2019, we had 30 overdoses and 1 fatality. For that same period in 2020, we had 23 overdoses and 6 fatalities. And I don't know if the pandemic had any play on that, but it certainly is suspicious that we were coming out of the gate in 2020 with some really encouraging data that we were having a profound effect. And then, of course, our tactics had to change due to the COVID-19 pandemic, where we couldn't go out with our outreach teams and connect people up to the resources. And as you can see, our overdoses were down by 7, but our fatalities was up by 5. And to be quite honest with you, that's unacceptable. So that was kind of discouraging, but we're hoping to get back on track here real soon. Some of the areas that we need to improve in, and some of the barriers that we need to overcome is I see a greater need to focus on prevention efforts. I would like to see that. I would like to see an improvement in greater access to harm reduction methods, such as fentanyl strips and the expansion of the syringe exchange program. Transportation to medically assisted facilities really seems to be one of the largest obstacles that we have. Currently, we are asking people to take individuals to these facilities in their privately owned vehicle on their dime. And that's a lot to ask. And I'm very appreciative of the community that we live in, that they have answered that call. But I think it's time that we find funding for that sort of obstacle and barrier. We need to improve the access to the availability to these facilities, make it more streamlined. I'd like to see on a personal level, a lot more education and training for all first responders. We do a really good job here at the PD, but we are just one spoke in the wheel, and I would definitely like to expand that. I would like to see some long-term care and support for those in recovery. Far too often it ends as soon as they leave that facility. And I think they're very vulnerable and they need help afterwards. Continue community forums. Stigma is a huge problem and we need to eradicate that. And the only way we're going to do that is constantly hold educational community forums to educate the community about substance misuse.
Right.
And something very interesting that I would just like to put out, and then I'll pass the baton. There was a survey done throughout Vermont, and there were 80 participants, and these were current users that did this survey. 27 of them were from Windham County. Some of the takeaways that are very interesting to me as a law enforcement executive and in Project Care member is what they found were some of the biggest obstacles and barriers, and from what I just mentioned. Transportation to and from medical assisted facilities was listed top on their list. Outreach needs to promote more syringe service programs. Educate the public on the Good Samaritan law. 50% of the participants were not aware that such a law existed. And that's very concerning to me because I can only hope that they're not calling us because they have conditions of release or there's drug paraphernalia or actually drugs on scene.
Right.
They think we're going to arrest them, and which is not the case.
Right.
Stigma surrounding substance misuse, they said was still an issue, and also the need to make fentanyl strips, testing strips available. So I just, that last part, I just found it very interesting that from what we as collectively Project Care saw some obstacles and barriers that we were running into, that it was pretty much echoed in the survey that was done throughout the state.
Thank you.
Thank you, Chief
Thank
Fitzgerald.
you, Chief.
You're welcome.
Thank you. We're going to hear from Kurt Wright now. Kurt White, sorry. Hi, Kurt.
Hello. All right. I'm Kurt White. I work at the Brattleboro Retreat. I oversee the inpatient, outpatient clinical services there. Nice to see you again, Congressman, and thank you for your leadership. Absolutely. I was asked to talk not just about the retreat today, but about the sort of treatment efforts in the community, and I'm happy to do that. It's an interesting and complicated time. It reminds me of my fondness for spaghetti westerns. I do think it is a tale of the good, the bad, and the ugly here. I'll start with the good. The good, I think, is that even before the COVID situation, Windham County was really making some significant strides toward reducing its opioid problem, which has really been, for a variety of complicated reasons that Rosie outlined, a very serious problem in the state. But efforts related to, I think, the COSU project, individual providers initiatives, Project Care, and the intense collaboration between providers had really started to bear significant fruit, and we were able to start to see that in the data. The story of treatment in this county is really a story of intense collaboration that we're all very proud of. When I surveyed and canvassed providers about it, that was the story that they wanted to tell. HCRS, BMH, the retreat, the police department, Turning Point, other providers, all working together toward the same sorts of goals. We've got rapid access to medication-assisted therapy happening in the emergency room. During the time of COVID, we were able to even find ways to make it so people didn't have to go to the emergency room to effectively get very rapid access, even bypassing some of our usual procedural obstacles and hurdles. And I think that COVID has actually created quite a lot of creativity and flexibility among providers. And so I think we're actually problems that had seemed unsolvable are now we're now making strides on. You know, we have I think we'll hear from Rihanna in this conversation, but we do have folks that would be camping in tents right now off the street. That's very powerful. I think that kind of thing needs to continue. Right. We have broad state and federal support for relaxing bureaucratic rules that maybe didn't make a whole heck of a lot of sense to begin with, that make it easier for us to reach and serve the people who really need the most help quickly. Along those lines, I thought I'd throw in a couple things that maybe I could ask for, because I think on the federal level it would be really useful if we had some very specific continued support for telehealth services continuing to operate beyond the time of COVID. I think CMS
I think we'll get that because the telehealth has been absolutely fundamentally important. People are at home and they can't get out, and the utilization of it has been essential, but also the feedback about the intimacy of the interaction and the ease of the interaction has been very, very positive. So I think that what we saw, there's enormous support to make telehealth a permanent part of our delivery system.
That's wonderful. And I think and I think that's essential. I've come to see it as an access issue, an equity issue, and also disability rights issue. If people don't have to always have to get out of their homes, which may be a physically difficult thing to do as well as a practically difficult thing to do in order to have support and treatment, that's really essential. The other thing, I think, if the federal government could help a bit on the leadership around interstate compacts related to professional licensure. CMS recently declared that interstate compacts were valid forms of licensure between states, and I think but I think if there could be some sort of technical assistance or incentives to states to explore those kinds of options, because problems don't stop at the state border. I think if the feds could be a leader on that, that would be really helpful.
Good idea.
Yep.
Thank you.
And we're all very proud of the way that we've had to rapidly pivot to doing a completely different kind of work. We're still sort of figuring it out, building the bicycle as we're riding it. A couple things on the bad and the ugly side. Well, the bad is really what others have mentioned and what you yourself mentioned, which is that we're already seeing overdose deaths increasing. The data that we already have suggests that there is that people who are hanging on by a thread are no longer hanging on. They really are at their most vulnerable, and the sort of isolation of being in quarantine, of being physically distant from people, and stress about the events happening in the world are affecting people in very profound ways. And I think the thing that I'm worried about most, the ugliest part, the part that really keeps me up at night, is what will we really see when we have all of the data later on?
Right.
The metaphor I think of is like Hurricane Katrina and the flooding in New Orleans. You know, when the floodwaters recede, what will we find there? And my suspicion is that things are worse than we really understand it right now.
Well, I share that fear. I mean, that's what I was saying in my opening remarks. Yeah, I think it's wise to anticipate that.
And I think that treatment can be a big part of the solution to that. And but I think maximum flexibility and collaboration would be essential.
Thank you, Kurt. We're going to move to Rihanna from Groundworks. Rihanna, oh, there you are. Thank you.
Thank you so much. I was reflecting when I had to look back to the last time we did this, that 2018 at this point feels a bit like a lifetime ago. I think, you know, in thinking about what others have shared, I guess I should start. I'm Rihanna, I'm the Director of Operations for Groundworks Collaborative. We're the agency that supports folks in the greater Brattleboro area with food, shelter, and supportive services. And although, you know, I think to echo other folks, we certainly have made some strides since 2018 when we last spoke, through the formation of Project CARE, through the formation of the COSU, and through just the direct collaborations through a number of agencies in the community. And I think the piece that I was asked to speak about today is the impact that we've seen through COVID-19 on, you know, our most vulnerable population in the community, which is something that I spend a lot of time talking about recently. And I think, as many people here know, as COVID-19 began to progress, we were identified early on as one of the hotspots in Vermont based on the number of homeless folks that we serve in emergency shelter. And so we began to house people in motel rooms, moving them from both our year-round emergency shelter and our winter warming shelter. And within a 2-week period in March, we ended up closing our emergency shelter, moving folks all into local motels, moving staff to provide support 24/7 at one of the motels to the bulk of folks, but also to support the other area 4 motels where we knew we had folks through the emergency motel program. So lots of coordination through a state level and with individual folks to get them to a place where they could safely isolate, which is an interesting concept because although we want to keep people safe from developing, wide-scale coronavirus throughout our programs, isolation also further illuminates the concerns that we deal with on a daily basis to support folks. And so, our work deals with a lot of folks with complex needs, mental health challenges, medical substance use, and often all 3 and more combined at the same time, and trying to pick apart which piece to support when and how is really complicated. Some of the changes that we saw were really positive. We could really quickly help someone gain access to the hub program at the Brattleboro retreat. In one early case, I can remember texting Kurt in the afternoon after someone had been released from incarceration and getting them in to be able to dose the very next morning at 7 a.m., something that is pretty unheard of before this time. The AIDS Project is providing on-site syringe services, and one of the biggest benefits we've seen is through Brattleboro Memorial Hospital. We initially had an embedded nurse practitioner, and when needs continued to soar, they were gracious enough to offer us a second nurse practitioner, and I see Matt Dove hiding on this screen, who specializes in psychiatric care, who's here every week trying to connect with people and help develop practices that are going to keep people safe. And at the same time, kind of in the realm, as Kurt talked about the good, bad, and the ugly, I feel like a lot of what I have to share recently is a little more on the ugly side. We have seen in the first month, I think we held together pretty well. We actually provided a fair amount of technical assistance to other programs across the state to really emphasize the need that the needs that we were seeing were social work problems, not law enforcement issues, not issues that should exclude people from emergency housing. And we saw people do pretty well. In our second month of the program, it really didn't look that way. We lost our first 2 clients, one who we discovered too late to revive on site with us, and just hours later, the same day, we saw a second individual who passed away, both from fatal overdoses. Both individuals had recently discharged from a residential program and didn't have the supports they needed to maintain that ongoing recovery. And although there had been all of these strides made in supporting folks, and these folks knew the resources, they knew who they could contact, but they physically couldn't see people in person to provide those services. And I can't highlight enough how important that is. 2 weeks after that, we lost another client who was housed in the community who left behind her young children, another fatal overdose. And just 5 days after that, for the second time, our staff tried to revive somebody unsuccessfully who was also lost to a fatal overdose. And it's fairly incomprehensible when we kind of sit back to fathom the loss of 4 lives in just under a month's time.
Right.
I know these losses were really felt across our community, and I don't think that I have all the answers. I think there are lots of really bright people here, and I think together we're working hard at this. I think the things that I've grown accustomed to in my work at Groundworks is that the services that we provide on site, where people are, where they're struggling, with an assertive engagement approach to continue to build rapport, even when things are hard and even when folks challenge us, that's when we're most successful. And I think there's a really delicate balance to developing rapport and building relationships with folks who may not be ready to make changes in their lives. And oftentimes that's where the disconnect happens, where we see people struggle. And sometimes the moments where people are ready to engage are so brief that we have to be able to connect people to those resources in that moment.
Wow. Yeah, just that moment.
Just that moment. We saw just last week somebody was ready and active and really needed to move away from the community and access treatment to make a change. And the response that we received was on a Friday that they could do an intake on Tuesday, and maybe 2 weeks after that they could get to a bed. And so I think some of
that doesn't work. Yeah.
Some of the rhetoric that we see around the fact that there's no wait list is untrue, because there's only a wait list if you actively build a wait list. If you tell someone that potentially you can do an intake and get them to a bed in 2 weeks, there's no wait list there, and yet somebody doesn't have the care they need to keep them alive.
I didn't know that.
Yeah, so our work in the community, I think, beyond just COVID, has really changed drastically over the past several years. We've really become the final safety net in our community, determined not to allow anyone to fall through the gaps that exist in the systems that are set up to support people. Our partnerships and embedded providers from the Brattleboro Retreat, BMH, and HCRS are crucial to supporting this really complex and incredibly vulnerable population. And I think, above all else, if there's one takeaway for me, both through research and evidence and the experiences that we see people live through in our community, we know that folks need access to housing in order to support work in these other areas of their lives, especially regarding substance use. And although we have some housing opportunities, we lack those that support people across all stages of their substance use, from active use to long-term recovery. Folks need to be able to access residential care, and if they don't do well there, they need to have a step down to a detox bed, and if they don't do well there needs to be a next step. We need to stop kind of spinning our wheels and seeing that people struggle and die in our community. And without that continuum of options, people will continue to. And I think beyond just the housing options, we also need service dollars to ensure that folks can continue to remain stable as they're housed and as they're doing well. We see people, ongoing support for folks is kind of a peaks and valleys system where people maintain for a while and do well, and when they're not doing well, we need to be able to support in that moment.
Thank you, Rihanna.
Thank you, Rihanna.
Thank you. So building off of what Rihanna said, I was thinking we can hear from Sue Connolly from the AIDS Project. Sue, are you there? I can't see you on my screen. If we don't have Sue, we'll move to Cassette. Oh, Sue, hi, Sue.
Thank you, and thank you, Congressman Welch, for allowing us to talk about.
Thank you. Thank you, Sue.
Especially harm reduction and syringe service program. So I work for the AIDS Project of Southern Vermont, and I run the syringe service program here. We are a fixed site, but we have been given permission during COVID to provide mobile services to people that can't access our fixed site, which we have been open throughout the COVID problem. We are open Tuesdays from 10 to 2 o'clock, but we're providing mobile services to people who can't make our fixed site on Thursday. One of the challenges that we've seen is, of course, the overdoses. So I'm being very careful and trying to get Narcan out as much as I can to help people so that they don't use alone, get the message out to have someone with them when they're using. The syringe service program is one of the places that people feel safe to come and talk about their use, and I feel like they have a place where they don't get judged, and so I think they hear messages a lot easier from a syringe service program and people that have a really good relationship with people who inject drugs. The other issue that I see is that I want to make sure that people are injecting safely, because the medical system is taxed right now, and making sure that people are using and not getting, injecting properly, not getting bacterial infections or endocarditis, which could land them in the hospital. So we've been really proactive in talking to people about safe injection. And at the moment, we're not able to do HIV or hepatitis C testing, which is the reason that we do provide syringe services programs so that people don't transmit HIV and hepatitis C. So that has been something that I'm concerned about, because I want to make sure people are using new needles at all the time, so they're not transmitting HIV and hep C. We have been referring to the Comprehensive Care Clinic and Planned Parenthood for HIV testing and hepatitis C testing at this time. We also provide support through phone. I have a cell phone that people can call me and talk to me if they're struggling. I've seen a lot of people want to get into treatment, talking to me about having just fed up with things right now, and they're really interested, or at kind of the pre-contemplation stage of wanting to get into treatment. So we're speaking with people. It's difficult for us to have a long conversation now with COVID, but through the phone conversations, I'm able to do a lot of support and talk to people. And there's a fair amount of people who are ready to get into treatment. We were in talks with the state of Vermont to embed a Suboxone clinic in the Syringe service program before COVID started. So after this changes, we're going to try to get that moving again. We're also moving to open a syringe service program in Bellows Falls. And I was told by the state of Vermont that I will be able to do mobile deliveries and exchange in Bellows Falls before we find a fixed site. So that is going to increase the amount of services that we can provide to that area. We also run a syringe service program in Bennington. We have done some mobile delivery. It hasn't really taken off, but we're working hard we have done some mobile deliveries there.
Thank you, Sue. Hi, thank you, Sue. Folks, we're a little short of time. We have a limited time, so we have two other speakers, but I ask if folks can keep their remarks to about 3 minutes, because I know that I'd love to open it up to a little bit more discussion and Q&A. I'm sorry, thank you. I know we have so much to share. So we have Cassandra Holloway and then Susie Walker. So we'll begin with Cassandra. Thank you.
Okay. Well, hello, Congress Welch.
Hi.
I know that you. Hi. I know you know a lot of the work that we do, because we see quite a bit when the CADCA has us come up.
Right.
And I know you. So I don't want to spend much time just kind of explaining the foundational work that we do. We are unique in Windham County because all 5 coalitions work actively together, and so we have a partnership that what came before the regional partnership grants, and will continue on beyond that. We have really worked together to create guiding principles that are focused on equity and ensuring that our efforts are connected to the beliefs and values of our communities. And I think since COVID is on the topic right now, I'll speak to that. I think that we are really trying to figure out how to support youth and families right now. Obviously, the youth are also impacted by all of the stress, isolation, and economic impact on their families. We already have higher risk youth, especially around our LGBTQ youth and low income families and children with ACEs. So, we're really trying to figure out how to support these families and their kids. During this time, the summer will be difficult because we have schools right now to help us connect to them. And we're just doing our best. We're doing some community hope raising and connections, such as the Hello campaign in Wilmington, Growing Hope Sunflower Project, where in Brattleboro, activity kits are being given out to kids and families in the Westford Valley Thrive area. And Greater Falls Connection is working with the mutual aid groups to also reach their kids. I will say that most of the teams that have been, some of the teams that have been actively working together in leadership groups are continuing to work together, and especially within the middle school, we're finding they're really eager to connect, to help their communities, to stay engaged, which is very awesome. But I think our biggest challenge right now is how this is impacting them when they've already are at risk, and individually and as families, and how to help families to connect during this time. Where they aren't necessarily used to spending so much time together. Right. And we're creating a resource guide for teens and their families to help them through this time, as well as looking at how we can help the schools, which, as you know, are very overwhelmed with helping the kids to transition back to schools,
Right.
especially if they're transitioning to a middle school or a high school, a whole new school. And we are grateful for the stability of our funding and how ADAP has supported us. We really are hopeful the state gets the Partners for Success grants, which we're a part of, and that will help us to continue the work we do. As you know, obviously, sustainable funding is always something that we are seeking, are needing, so that we can continue our work and just have the infrastructure that we need in our own individual communities. But we are working continually as a collaboration and a partnership, and working with our partners and hoping that they'll commit to our work.
That's great.
We can.
That's fantastic. You've adjusted.
Thank you.
Thank you. Yeah,
And I'm
that's really
good. I'm
good.
from Boston, so I can talk fast. Thank you.
On mute. I'm so sorry. Susie, we'll close with you and then we'll open up for some discussion, please. Susie Walker from the Turning Point. Susie, you're on mute, I believe.
There we go. Sorry. Thank you very much. I'm so glad to be
Hi,
here. And I'll
Susie.
just, much of what I've been hearing from our collaborators touches on what's happening for us as well. I'll use Kurt's good, bad, and ugly model. The good is that we've had to be very innovative and creative about our population of people in recovery. Our community and connection is so important that to suddenly have that immediate in-person connection gone has been a real hardship. And so while
It's got to be
good
brutal.
that we've been
Yeah.
able to offer remote supports. We have coaches at the center who provide recovery coaching over the phone for people who ask for daily or bi-weekly or weekly phone calls. So that's good. And we've got online groups that are happening. And our emergency department coaches are still in action remotely. So that's a good thing, but you know, the bad thing is that not everybody has reliable access to internet and phone service or even the devices for these things. So
Right.
there are a lot of people out there that we're simply not able to connect with. And as this situation continues, we want to be able to do a better job of that. So there's a lot of good there. And as we're able to open the center again, we'll maybe have just by appointment only coaching for people to satisfy that need to be in person.
That makes sense.
But what I can tell you is it's been a very scary and painful time for our community, our recovery community. Every time we lose someone here to an overdose, there's this ripple of pain throughout our own workforce, because they've supported these people and they knew these people, and maybe back in the day they even used with these people. So it makes it very real. And so we're doing a lot more support for our own team. And in fact, for our community and partners, has decided to do an online compassion fatigue workshop next week to just kind of say, you know, when you're so busy taking care of others, it's so important to take care of ourselves too. We have a Mothers in Recovery program, but right now to get, you know, we certainly can't do it in person, so we're trying to do that by phone and online as well. But again, with devices or even the lack of childcare, it's a very hard thing to do. But we're starting a book group next week called Sober Moms, using the book Sober Moms Guide to Recovery. So it'll be a book club that people can be part of and read those get those supports. And I can tell you that in the phone calls that we do, when we've had people involved in the program before, they might get a phone call, a quick check-in, and 5-10 minutes, but these people are wanting to be on the phone a lot longer. So it's taking more of our people's time because they have a need to talk to 30 or 40 minutes because they maybe don't have anybody to connect with, or they may not live with anyone. So there's that people are needing more time. And so that's good. And it's good that they're reaching out. The other thing that our coaches are doing is talking a lot more about harm reduction, just the idea that if you live alone and you're going to use, please be honest and tell somebody so that we can help make sure that you're okay. So we're doing a lot more harm reduction in our conversations about recovery. We've got people that are hanging on to their recovery for dear life. And we've got some that are in a good place, and we've got others that are really struggling because this is a scary time. They've got too much time on their hands. They're lonely, they're bored, they're scared. And so our connections with our partners are that much more valuable. Sorry?
It's got the circumstances have to aggravate the anxiety by a lot, I would think.
Sure.
Thank you.
And so, yeah, you're welcome. Thank you.
Thank you, Susie. We have Rose. I'm sorry. We have Rose Albert from the Windham County NAACP. Rose, you had a couple of questions, I believe.
Hello.
Hi.
Hi. Good morning, everyone. Thank you for letting us be part of this group, and it was lovely to hear from everyone. One of the questions that I have for all of our speakers this morning is that, especially for Windham County, I wanted to know if you have found, you know, a lot of research shows that Black and Hispanics are less likely than whites to complete addiction treatment. And I wanted to know, and the work that you are doing and the community that you are serving, that if you have found this to be the case in Windham County, and if so, in what ways have you been assisting with that process to make the numbers better for other people of other races?
Thank you, Rose. Did someone want to take that question?
Well, since it involves treatment a bit, I can briefly speak to it. I haven't seen any data that in Windham County about it one way or the other about treatment completion, but I do think the keeping the issue of likely inequities in the system that exist everywhere, that they probably also exist here, and that we ought to act as if they do and try to plan for that. That's been a central part of what we've been doing in the Windham County COSU, is to really think about who are the individuals that might be most vulnerable and most perhaps underserved and not reached through the sort of usual mechanisms that might unintentionally replicate a sort of institutionally racist structures, for example. And so we are working on that both at the individual agency level and at the sort of group community level, and could say more about that, but don't want to take more time right now.
Thank you.
Thank you. I know Elizabeth McEwen would like to say had some comments. Elizabeth? Elizabeth, you're on mute.
I'd like to first thank all of the hard workers in the community and tell you that as a woman of long-term recovery, I appreciate every day that people address and help people in difficult situations. And I just wanted to go along sort of the COSU thing about, I might be a noisy person from areas that are underserved. And I live in Wilmington, and there's a mountain between us and any of the services, pretty much. And we recently, due to a death of a student in 2018 it was, and that mom helped us sort of say, as a community, do we care? Do we want to do something? And so we have started something called the Voices of Hope. And we just finished the vision and mission statements. And so I just wanted to share those and remind everybody we're here. So the vision is to sustain a community that fosters connection, acceptance, creativity, recreation, health, and safety. And our mission is to inspire hope and contribute to the support of those affected by substance abuse. We advocate to increase local resources, raise awareness about use and misuse, and the importance of compassion within the Deerfield Valley.
Thank
That's
you,
great.
Elizabeth. I
That's
know
really
that
great.
I'm
Sorry.
sorry.
I know Representative Sarah Coffey would like to say something.
Sure. Good morning, everyone. Congressman Welch, thank you so much.
Hi, Sarah.
Yeah, for doing all that you're doing in Washington, D.C. and to be advocating for these dollars. The $1.25 billion package is something that's critical to Vermont's recovery. And I'm so deeply appreciative. And this week and next, that's our work in the House.
Mhm.
And I just wanted to let this group know that I've been following this work, and I'm really grateful and appreciative for all that you're doing. I sit on House Corrections and Institutions, so substance use and transitional housing and housing are issues that we are focusing on. We have a bill that we've been working on for months called For Justice Reinvestment 2 that we hope will there'll be policy changes and investments, we hope, in housing and programs for people. So all of what you're talking about resonates with me. And I have to say that it's remarkable the level of collaboration across organizations that we have in Windham County. And I'm sure you see that, Congressman, that this is kind of a unique and wonderful community. So I just wanted to say thank you for your work. And I hope to work with Peter, with you, but also folks should feel free to reach out to me anytime through my legislative email. So thank you. I'm sorry.
Thank you, Sarah. No, you guys have the big job because whatever money we're successful in getting back to Vermont, those tough decisions, trying to meet all of the needs, that's going to be your challenge in Montpelier. So good luck to you.
Thank you. And I'm sorry, I'm going to have to pop off. I'm sorry. Thank you.
Go ahead.
So much.
Thank you. Bye-bye.
If we don't have any other comments or questions, I think I'll turn it over to the Congressman to close.
Well, I really want to thank everybody. It's pretty inspiring to me because the really hard work is in the community itself. Because every person has to be treated individually, especially where it involves the challenge of overcoming a dependence on a substance. And the necessity for collaboration is so essential to any potential for success. And no matter what resources we're able to get back, it's never going to be enough to meet the need. And the need is going to be great. A couple of people refer to it, but there is no question that when there's an economic trauma, and this is severe, that the effects are grinding and oftentimes long-lasting and to some extent invisible, but they're real. And I know you know that better than anyone, and I know you're dedicated to trying to help folks cope as best they can. So I just want to say that as a Vermonter, my gratitude to you is heartfelt, and I look forward to working with you as we manage our way through this for the best possible outcome for the Vermonters we care about. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye.